I want you to take your hands, please, and rest them on your thighs. And when you hear one tap, I want you to please pick up your right index finger once and put it right back down again, just like that. Ready? Very good. Now when you hear two taps, please don't move your index finger. Just keep it still. Okay, let's try that again. Okay. Ready? Good. Good. Now I'm going to mix them up. Ready? Very good. Can you tell me how an apple and a banana are alike?
They're both fruits.
Can you tell me how a car and a boat are alike?
They're both objects that provide transportation.
Right. And if Mary is taller than Jane and Jane is taller than Anne, who's the tallest?
Mary.
The patient should be assessed for auditory, visual, and other hallucinations, as well as for delusional thought processes. Mood and affect should also be assessed through specific questions, as well as through nonverbal cues and social interactions occurring throughout the patient. Can you please cover the right side of your nose, your right nostril? Close your eyes and tell me what you smell.
Soap.
Okay, very good. Cover your other nostril, please. And tell me what you smell.
Coffee.
Very good. To view the fundus, an ophthalmoscope is used, and the patient is asked to look straight ahead while the eye is approached at an angle of approximately 15 degrees. Please look straight ahead. Can you cover your right eye, please? What color is this?
Red.
Cover your other eye, please.
Red.
Does it look the same color with both eyes? Switch
Yes.
back and forth quickly. Does it look the same? Look right at my nose, and I'm going to check your visual fields, okay? I want you to tell me how many fingers you see in each hand.
One. One and one. One and one. Two. Two and one. One and two.
Very good. Tell me which side you see the fingers wiggling on.
Your right.
Point to the fingers that are moving.
Both. Both.
In patients who have impaired mental status who cannot cooperate with the visual field examination, blink to threat can be used. Although this patient has intact mental status, I'll demonstrate this now just to show the movements that are used. Okay. Can you cover your right eye, please? What color is this?
Red.
Cover your other eye, please.
Red.
Does it look the same color with both eyes? Switch
Yes.
back and forth quickly. Does it look the same? Look right at my nose, and I'm going to check your visual fields, okay? I want you to tell me how many fingers you see in each hand.
One. One and one. One and one. Two. Two and one. One and two.
Very good. Tell me which side you see the fingers wiggling on.
Your right.
Point to the fingers that are moving.
Both. Both.
In patients who have impaired mental status who cannot cooperate with the visual field examination, blink to threat can be used. Although this patient has intact mental status, I'll demonstrate this now just to show the movements that are used. Okay. Look straight ahead, please. To test pupillary responses, shine the flashlight in each eye and measure the diameter of the pupil in millimeters, noting also its shape in the eye the light is flashed into, as well as the consensual response in the opposite eye. Can you look at my finger, please? And observe the pupils as the fingers move towards the eye and away from it. Please look at my fingers and follow them with your eyes. Look right at me, and now I want you to look at my thumb without moving your head. Look at my finger, back at my thumb. Without moving your head, look at my finger, thumb, finger, thumb, finger, thumb. Good. Now look at my thumb, finger, thumb, finger, thumb. Please look straight ahead and count the stripes as they go by in front of your eyes. Very good. Good, good. And one more time. In patients with impaired consciousness, the eye movements as well as the vestibular system can be tested with the oculocephalic maneuver, in which the head is moved side to side. It's important to ensure that there's been no cervical trauma prior to performing this maneuver. The head is turned rapidly from side to side while observing the patient's eye movements. It can also be done moving the head forward and back. In the normal conscious individual, the reflex eye movements in the opposite direction of the head turning are not. Does this feel the same or different on both sides?
Feels the same.
Okay. How about here and here?
Feels the same.
And here and here?
Feels the same.
Please close your eyes and tell me which side I'm touching.
Left, right, both. Left, left, both.
Good. The corneal reflex is tested by having the patient look up and using a cotton-tipped swab. Can you please clench your jaw tight like this? Good. And I'm feeling her masseter muscles and relax. And again, clench and relax. Okay. Open your mouth slightly and relax. Very good. Do you know any good jokes? Okay, let me see all of your teeth, please. Good. And puff up your cheeks. Good. And close your eyes real tight, and don't let me open them. Close your eyes tight. Very good. Taste can be tested with salt, sugar, lemon juice, or similar materials on the cotton-tip swab against the side of the patient's tongue like this. Please close your eyes. What do you taste?
Sugar.
Very good. And what do you taste?
Salt.
Close your eyes, please. Tell me which side you hear my fingers rubbing on.
My left.
Right.
This one.
Right.
Both.
Very good. Okay. Do you hear this?
Yes.
Is this louder or is this louder?
The first one.
Okay. And is this louder or is this louder?
The first one.
Very good. Do you hear this louder on one side than the other?
No, it feels equal.
Thank you. For positional testing to detect abnormal vestibular function, the patient sits near the edge of the table. The head is turned in one direction with one ear down, and then supporting the head, the patient is asked to rapidly lie back, and eye movements are observed looking for nystagmus while the patient reports any symptoms of vertigo. Once the eye movements and vertigo have abated, the patient then sits up, and the same eye movements and symptoms are reported. The normal individual has no nystagmus or vertigo with this maneuver. The maneuver is then repeated with the head turned in the other direction. Open your mouth, please. Say ah.
Ah.
Very good. Please say pa 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 pa.
Pa 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 pa.
Good. Ta 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 ta.
Ta 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 ta.
Good. Ga 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 ga.
Ga 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 ga.
Please turn your head that way. Don't let me push it back. Good. Please turn your head that way. Don't let me push it back. Good. Please pick up your shoulders like this. Good. And please move your head forward and don't let me push it back. Okay, I'm just going to test the tone in your arms, please. Can you relax? Very good. Relax. Very good. Tone in the legs can be tested by asking the patient to please relax, and then suddenly bending the knee. Normally, the heel drags right along the surface of the bed with normal muscle tone in the legs.